Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in their profession. Today we'll be seeing about the competitive exam questions with the rationale the students who are preparing for their nursing officer examination. This is a part 2. Already I have uploaded a part 1 video. Kindly check the description box. Today we will be seeing another 5 questions related to the preparation for the nursing officer examinations. So if you want me to add some more questions like 10 questions a day means, if you comment in the comment box, I will add the again 5 more questions to this video. So till now we are seeing only the 5 questions, so that it will be easy for you to understand and think how the scientific principles we have to apply it while answering the questions. Let's get started. So first question is, a patient rushed to the emergency room after being found unconscious at home. His blood pressure is 70 by 35. The nurse anticipates an order for what medication? So we are receiving the patient from the home. The patient's blood pressure is, the systolic is 70 and the diastolic is 35 mm of Hg, and she gets an order to administer the medication. So among these 4 options, what medications the nurse has to administer? We will see the options first, then we will see the answer. So option A is atropine sulfate, that is atropine, and option B is amiodarone, that is cardarone, and option C is magnesium sulfate, and option D is adenosine, that is adenoscan. So among these 4 options, since the patient is having hypotension, that is reduced blood pressure, that is 70 by 35 mm of Hg, so we will get, as a nurses, we will get the order of administering what medication is atropine sulfate. So it is very direct question. So if a patient is coming with a bradycardia, immediately we will get an order to administer the atropine sulfate, that is atropine. Whereas the other options like amiodarone and adenosine, these 2 medications are administered for a patient who is having tachycardia. And whereas the magnesium sulfate is administered for a patient with ventricular fibrillation or ventricular tachycardia. So the remaining 3 options, the amiodarone, magnesium sulfate and adenosines, these all medications are given for a patient with tachycardia. Whereas in the question it is given the patient is having low blood pressure, that is bradycardia. So we will get the order of administering atropine sulfate. So this question is a very direct question. So you need not think in a very complicated manner. So when you receive a patient with bradycardia, you have to administer atropine sulfate. This is the common thing that you have to keep it in mind. So whereas we have to see which option is best for the questions. So based on that we have to answer it. So it will be easy for you to understand. Also it will not take you in a time consuming way. So this is the answer for the first question, atropine sulfate. So next we will move on to the next question, second question. So the second question is, and an 82-year-old woman is being admitted to a long-term facility. Her assigned staff completes full assessment, including calculating the risk for skin breakdown based on the Braden scale. To determine a Braden scale score, the nurse evaluates all the following except. So you have to be very careful in the questions, they are giving except and all. So first one is option A, nutritional status, option B, sensory perception, option C, past history of skin breakdown, and option D, activity level. So here also it is a very direct question. So they have given you a small twist by adding the word except. Except means nothing but according to these 4 options, what option is not coming under the Braden scale assessment score. Okay. So if we consider about the Braden scale assessment score, nutrition status, yes, of course we will assess the nutrition status of the patient. Sensory perception, yes, of course we will assess it. Next, activity level, yes, we will assess. Adding to this, what and all we will assess is, we will assess the moisture of the patient and fracture or shear. So what is not included in the Braden scale is past history of skin breakdown. So the answer is past history of skin breakdown. So except means according to that question, what is not included That is, we have to consider and we have to answer it. So this is a direct question. Next question is, the nurse recognizes all of the following as a common physical characteristic of a child with a Down syndrome. Again, here word it is given except. So there will be a 4 options. Among that 4 options, one is not related to the characteristic features of the Down syndrome. So that is the question. Okay, so first we have to understand the questions very carefully so that we can omit among the 4 options, we can omit one of that. Okay, so first one is small low set ears. Option B, downward slanting eyes. Option C, hyper flexibility. And option D, enlarged tongue. So it is also direct question, but small twist they have given. See, in a child with Down syndrome, they will have a small and low set ears. What is meant by low set ears? When we are drawing a line from the outer canthus to the ear, we will be able to touch the ear. But whereas a children with Down syndrome, it is difficult to touch the ear because the ear will be very low. That is known as low set ears. So next, option C, yes, the child will have hyperflexibility. And option D, enlarged tongue will also be there in the child with the Down syndrome. So only they are having protruding tongue. So whereas here, according to this question, which is not included in the Down syndrome is downward slanting eyes. So if you have studied properly, means it will be very easy to answer, because in the theoretical part it is given the children with the Down syndrome have upward slanting eyes. Okay, so whereas in the option they have, to make us as a confusion, they have given downward slanting eyes. So the children with the Down syndrome does not have downward slanting eyes, whereas they will have a upward slanting eyes only. So among these 4 options, low set ears will be there for the children with Down syndrome. Hyperflexibility will be there. Enlarged tongue will be there. Adding to it, single palmar crease will be there. So this is the clinical features of a children with the Down syndrome. This Down syndrome is otherwise known as trisomy 21 also. Okay, so according to this question, which is not in the characteristics of Down syndrome, is downward slanting eyes. Okay, so next question is, this is a calculative question. This is also a direct question only. A client with blood pressure is 132/84 mmHg. What is the mean arterial pressure? They have asked. So according to this question, the systolic blood pressure is 132 mmHg, and what is diastolic pressure? That is the downward 84 mmHg. Okay, so they will give a 4 options. This is also, by knowing the formula, it will be easy to answer it. Okay, so the first option is 79 mmHg, option A, and option B is 48 mmHg, and option C is 92 mmHg, and option D is 100 mmHg. So according to this question, when we apply the formula, we will get the answer. So direct, it is also very direct question. By applying in the formula, it is easy to answer it. Okay, so the answer is 100 mmHg. So now we will identify how this 100 mmHg has come for this question. Okay, so before that we must know what is the formula of mean arterial pressure. So the formula is, mean arterial pressure is equal to 2 into, that is multiplied by, diastolic pressure plus systolic pressure divided by 3. So what is diastolic pressure? 84 mmHg, and systolic pressure is 132. So by applying these values in the formula, we will get. So according to Bodmer's method, first we have to do the multiplication. Okay, then only we have to do the addition. So 84 into 2 is 168 plus 132 divided by 3. So that is whole divided it will come. Okay, when we take that LCM and all. So according to this, we will get a 300 divided by 3. So 168 plus 132 divided by 3. So what is the value of 168 plus 132? That is 300. 300 divided by 3 is 100. So this, by this only we have got the mean arterial pressure of 100 mm of Hg. This is also very direct question. So by applying in the formula, you will get the answer very easily. So sometimes what happens, the students will think in a very complicated way, so they don't, if they are not knowing the formula, it is difficult to answer these kind of questions. So this is a very direct question. So far we have seen many questions that is very direct. You need not think in very complicated way. It is very direct questions in today's video. So next is, we'll move on to the last question. So the sequence of number is being changed, but whereas this is the last question. Okay, so next question is, the nurse is creating a discharge plan for a client with cholecystitis. The nurse should encourage the client to follow. Okay, so what is meant by cholecystitis? It is an infection and inflammation of the gallbladder. So for the patient with cholecystitis, what diet the nurse should give? That is only the question. Okay, so first option is a diet low in potassium. Option B, a diet low in fat. Option C, a diet with increased vitamin B12. And option D, a diet low in phosphorus. So when we see the options, it is very clear that option A and option D, that is a diet low in potassium, a diet low in phosphorus, it is recommended for a patient who have a renal disorder. Okay, for renal patients only we will give a health education to have a diet that is specifically low in phosphorus and potassium. Okay, so next option C, if we see, means a diet with increased vitamin B12. This is recommended diet for the patients with the pernicious anemia. If they are having pernicious anemia, we will encourage them to take the vitamin B12 rich food. So whereas here in question they have asked what diet has to be given for a patient with cholecystitis. Okay, so that we will give as a discharge plan. We will tell the patient to have a diet low in fat. So the rationale is, a client with cholecystitis have an inflamed gallbladder and they should avoid a high fat. Okay, so this is also a direct question. So when you are considering about the cholecystitis, you have to give the low fat diet for the patient. So that's all about today's video. If you have any doubt, kindly drop down in the comment box, and if you want me to improve or add on any questions to the videos, you can the constructive criticism is being welcomed. Thank you for watching. Kindly like it, share it and subscribe it.